Hi, everyone. Thank you for joining us today for the benefits meeting. Most of you know me, but just in case you don't, I'm Holly Francois. And as CFO, benefits is part of my responsibility. I'm really proud to work with a talented benefits team. Thank you. We are fortunate to have a strong group managing these programs with expertise and care. And I'm here to talk with you today about the healthcare changes that were recently announced. And I understand that healthcare changes can be challenging. And I recognize that some of the updates shared earlier this month may feel personal, especially if they affect you directly. We're navigating a time of rapid change in the healthcare system. It's driven by rising costs, new treatments, and evolving industry practices. Our goal today is to be transparent with you, to help you understand what's changing, to walk you through the reasons behind these changes, and let you know that we'll planning to support you through this transition. So let's take a look at our agenda today and what we're going to cover. So we're going to talk about what's changing. I'm the one going to come up here and talk to you about those decisions and why we made those decisions. We're also going to talk about the Maritz medical plan options, so you have a couple plans to choose from. And we're going to give you some examples today that will help you select a plan for you and your family. And then we have some open enrollment information and some other important information, like some fun things related to the dental plan and stuff like that. Not sure I got that order fully right on the bottom, but that's what we're talking about today. Okay, lots of things on these slides. I am going to start by going over what's changing at a high level. But what I want to really talk to you about today is why we made those changes and what's driving the change. Later, Jen, Debbie, and Michelle are going to come up and they will talk about the changes in detail. So let's just talk at this high-level overview, which is on the left side of the slide. So first, this is effective January 1. First, spouses who have access to their own employer-sponsored health care plan are no longer eligible to join the Maritz medical plan. Weight loss drugs will no longer be covered under the plan. We are adding a new lifestyle program, which is called NOOM, N-O-O-M, and that's for all medical plan members. We also have two programs in our plan today, Livongo and Omada, that will be going away because they overlap with NOOM. And Debbie, from our benefits team, is going to go through and talk in more detail in a few minutes about these changes and dive into them. So now I'm going to switch to the right side of the plan. But before I talk about the why, I want to talk to you about our plan. So it's important that you know that we have what's called a self-insured health plan. And what that means is that Maritz pays for every claim that comes through our plan. That's every doctor's visit, every procedure, and every prescription. We don't simply pay premiums to Cigna. We directly fund your healthcare costs. Cigna simply processes the claims, and then they pay it directly from our bank account. Most employers our size have a self-insured plan, so this is not unique. Another type of plan is called a fully insured plan. And a fully insured plan is where an employer pays a flat premium to the insurance carrier, and that insurance carrier then bears all the risk. That plan would be much more expensive than what we have today for a population of our size. Okay, so that's the background of how our plan is designed. So why are we making these changes? We've all felt the effects of inflation in our daily lives, and our healthcare plan has been impacted as well. During the past 3 years, our healthcare claim costs have increased an average of 18.5% annually on a compound basis. We've worked really hard to absorb those costs and those increases over that time while keeping employer premiums reasonable and avoiding reductions in benefits wherever possible. However, our plan can't continue to sustain those types of increases. Our consultants for calendar year 2026 are projecting another 16% increase. And I will tell you, those projections over the past 3 years that they came in with have been low. So that's what's forcing us to take some further actions to protect the long-term sustainability of our benefits. So let's talk about how we made these decisions. At Maritz, we have a healthcare committee that collaborates very closely with our benefits team. And they play both areas, play a central role in evaluating and guiding our employee medical benefit strategy. And that healthcare committee includes Karen Staten, who is VP of Employee Pay and Benefits. It includes Jackie Richards, our Chief People Officer, and myself. And this year, because we made some significant changes to the plan design, we also ensured we had alignment and support from David Peckinpah, Steve Maritz, and our board of directors. This year, we spent months evaluating a wide range of scenarios and options. We also took additional time to finalize our plan because the healthcare landscape is evolving so rapidly. We held this decision open longer than we typically would because there are so many developments that are occurring around access to and pricing of weight loss medications in the marketplace. Throughout this process, our priority has been to identify solutions that would minimize disruption to our employees. It would still provide comprehensive, affordable option for healthcare to our employees, and also combat the healthcare inflationary pressures that we're seeing. To ensure our decisions were both effective and competitive, we engaged multiple external consultants, and we benchmarked our plan against similar employers. We are not alone in this situation, and other employers are having to make difficult decisions as well. The decision to change spouse eligibility for our medical plan and the decision for excluding weight loss drugs was not taken lightly. After implementing the changes, we were able to pass along below average increases to employee premiums of just 3 to 6% this year. And that depends on the coverage that you select. The national average this year is about 8 to 10% of an increase. We are not removing spouses if they do not have other employer-sponsored coverage that is affordable. Any spouse who does not have access to affordable, comprehensive coverage from another employer may still join our plan, and there are guidelines and rules around what that means. Many employers implement spousal surcharge or exclusion provisions to help manage costs in their plan. We are aware that certain weight loss drugs have been instrumental in the health and well-being for many individuals. However, the cost of these drugs for employers has risen dramatically over the last few years. And it's placed a financial burden on our plan, with only a small percentage of our members using those drugs, which is about 8% of our members. So let's talk a little bit about the cost of weight loss drugs. Maritz pays a little over $1,000 a month for each member that's taking these medications. If you do the math, multiply that by 12, these are long-term drugs. That's $12,000 a year per person. Currently, we have about 200 people that are taking these medications. So again, if you do the math, 12,000 times 200, we're paying $2.4 million annually today. During the first 6 months of this year, we spent more money on Zepbound, which is the most prescribed weight loss drug, than we did on any other drug in our pharmacy plan. Continuing to absorb that type of expense would mean passing along a significant premium to all employees, even those that aren't utilizing weight loss medications. We understand that weight management is a very personal journey for many of you. The decision is not meant to diminish the importance of or effectiveness of these medications. Rather, it's a step we had to take to ensure the long-term sustainability of our health plan for everyone. While it's true that about half of employers already exclude weight loss medicines from their coverage, we understand that this may still be disappointing for some of you. But ultimately, we had to find a reasonable balance between offering affordable coverage to all employees and maintaining the financial health of our plan. So, that's one of the reasons we are introducing Noom as an alternative. We are committed to supporting employees in their own personal health journey, whether that is improving overall wellness, managing a chronic health condition, or achieving a healthy weight. So Noom will be available to all plan members, all medical plan members, sorry. And Noom is a robust program that's personalized to each person to meet you wherever you are in your own health journey. Noom also offers discounts on certain weight loss medications. And Debbie is going to share more details about that and Noom shortly. So, once again, I want to reiterate that these decisions were not made lightly. They were difficult decisions to make, but they were necessary to control plan costs. We are committed to supporting you through this transition, and I hope you see that we are committed to being transparent to you in what we're facing. We are going to have a Q&A session at the end of this meeting, and we're going to do that through Menti. Any questions that you ask will go directly to a member of the benefits team for privacy reasons, but I encourage you to ask questions. Thank you for your feedback. It's important. We will continue to listen, and we will continue to adapt as we move forward. I'm going to turn it over to Debbie Genty now to review the changes in more detail, and I want to thank you for your time, for coming in person, and for attending online today.
Thank you, Holly. Hello, everyone. I think a lot of you know me. I'm Debbie Genty. I'm the Senior Manager of the Benefits Department, so thank you for joining us. And I hope you understand, after Holly tells you, it was the cost. I mean, when we saw the cost of those drugs, it was like, wow. And, you know, we're used to looking at some really big numbers. We very much care about everybody's health. We have our own wellness department, so that's very important. As she said, it took them months. I was like, when are you going to make a decision? I have to start getting the communications out, you know. So it took them a long time to they really wanted to make sure they were making the decisions, that there was really no other choice. So first, I'm going to go over the details now of the changes that she told you about. So first, we're going to cover the spousal change in spousal eligibility. So as she said, if your spouse has access to employer-provided coverage starting January 1st, they can no longer be on our health plan. Now, this is only employer-sponsored health coverage. So we've had some questions where people said their spouse is retired, but they're eligible for Medicare. That's okay. They can still be on our plan because they don't work for a company that pays them a paycheck and offers them health insurance. Same question about they have a spouse who has veterans benefits. That's okay. They can still be on our plan or eligibility for that. And as Holly said, it only applies to spouses who have access to employer coverage that meets the affordability and minimum essential coverage requirements as outlined in the Affordable Care Act. And you're like, well, how do I know what that is? Most employer plans are going to be major medical plans. They're going to cover your hospitalizations, diagnostic testing, all the main things that most medical plans have. If you feel like your spouse has access to a plan that really is more of a minimal kind of coverage that barely covers things, you can come to us and we can help you do an analysis to see if it's something that qualifies for them to stay on our plan instead. So as we said, if your spouse does not have access to an employer-sponsored plan, they can be added to the Maritz plan. And this change only affects the medical and prescription plans. It does not change their eligibility for dental, vision, life insurance, or any of those other supplemental benefits. They can still be on those plans. When you consider enrolling a spouse on their own plan, it may end up being more cost effective. Sometimes people think, well, we're going to stay together on the same plan because it's just easier that way. But when you really go and look at the analysis, it depends on what the deductibles are, what kind of plan the spouse has access to. But you don't want to just look at premiums. You want to look at the deductibles too, because you might want to consider if you have children, does it make more sense to have the spouse cover the children too on their plan? Or maybe if they don't have any kind of exclusions for spouses and it makes more sense to have everybody move to that plan, if they allow that, really evaluate all your options and all your scenarios before you make your open enrollment elections here. If your spouse has an open enrollment period that's coming up between now and the end of the year, they need to go ahead and enroll in that medical plan during this year's open enrollment period. And when you do your open enrollment elections, you should not enroll them. If you have a spouse whose open enrollment period may have just ended, like maybe they have theirs the first half of October or the last half of September, by us saying that they're no longer going to be eligible in our plan after December 31st should be considered a qualifying event that would allow that employer to let you have another 30-day open window to get enrolled in that plan. They may ask you to provide documentation, so you may have to come to us and get a letter on our letterhead, because if you just take them, well, my husband or wife got this email, they're going to say, well, it has to have your name on it, needs to be on letterhead. We don't know if you found this laying on the ground somewhere, So we do have a template letter prepared for you on letterhead that we can just drop in your name and give to you so you can provide that to them, and it shouldn't be a problem. If you do try to enroll a spouse during open enrollment, it is going to require documentation proving no access to an employer plan. So when you make your open enrollment elections in Workday, you will be prompted to make a selection regarding spousal coverage. You're going to see your tiles, your medical, dental. There's going to be one called spousal coverage too. So you're going to have to click on that and make an election to say if I'm not enrolling a spouse, or I have a spouse, I'm enrolling a spouse, but they don't have access to other coverage. I have a spouse who's self-employed, and whatever you mark, then read the instructions on that page, because it's going to tell you if you need to submit additional documentation. If you say you have a spouse that's employed, but they're not eligible for coverage through that employer, there's going to be a link on that page to a form that you'll need to have your spouse's employer fill out, confirming they're not eligible. Send it to the benefits department within 7 days, and then we will let you have that spouse be enrolled on our plan for 2026. Okay, so if you have questions about the spousal stuff, we can ask that at the end, but now we're going to move on to the weight loss medication coverage change. As Holly said, all weight loss drug medications, it's not just GLP-1s, it's anything that's taken just to lose weight, will no longer be covered under the Maritz medical plans. But this change does not impact members who are taking GLP-1s to manage diabetes. So if you're taking the Mounjaro and Ozempic for your diabetes, then that will still be covered under the plan. And we do recognize, as she said, it's very deeply personal, and we know that there's people on these medications that have had a lot of success that nothing else worked for, and we really did not want to have to make that decision. It just was the point where we really didn't have a choice. But we do continue to try to provide other resources to help you on your wellness and weight loss journey through other things like we're continuing our partnership with Personify Health, the wellness provider. And as she said, we're adding Noom, and I'm going to give you a little bit more information about that in a second. And that's at no additional cost to you if you're enrolled in the medical plan. People who aren't enrolled in the medical plan have access to the Personify Health portal to have, you can have access to their wellness tips and all that kind of stuff there. You just can't earn the confetti points and stuff like the people enrolled in the medical plan have access to. So Noom, it's available to anybody in the medical plan who you or your spouse or children who are over 18. It covers a personalized weight management, so it's going to be targeting a program specific to your needs, whatever you need. They also have, it's this one program, it's one provider that has multiple programs. So, in the past we had like Omada had the weight loss and prediabetes. We had Livongo that had those with diabetes or hypertension. So Noom can handle all that in one program. And we actually, when we had the demo of that, it actually seemed to be a lot more engaging, and I really liked a lot better than what I had seen with Livongo and Omada. So hopefully you will too. But it combines behavioral coaching with clinical care, so it can provide weight loss medication access to eligible members. So I'll get into that a little bit more on the next page. But you also still have access to the Personify Health stuff, like we said, and Headspace, our EAP. Both of those are app-based platforms that support everything from physical, emotional, financial, and social well-being. They give you daily tips, challenges, and habit-building tools that you can have. With this and Noom, even if you're on the weight loss medications, you have better success of losing even more weight if you also add on these extra resources. That'll help you lose even more than just taking the drug and letting that do all the work by itself. They're very good, I can tell you, but it really helps to even add this extra support as well. But you also can talk with a life coach to get truly personalized support, so it's not just getting resources online. And then Headspace also has digital resilience training to support your mental health. And if you're medically enrolled on the plan through Personify Health, you can earn up to 300 confetti points for engaging in healthy activities throughout the year. So anybody who continues to take weight loss medications starting January 1st will no longer have coverage. You're going to be responsible for the full cost of that. And the expenses don't count towards your deductible or out-of-pocket maximum either, because only covered services or expenses under the plan will apply to those accumulators. You can continue working with your current provider to have them prescribe it and get it through the local pharmacy, which generally you would normally be paying full cost, but there are various direct-to-consumer options available in the market. Some, you can talk to your doctor to see I'm sure your doctor prescribes these medications for other people who don't have it covered under their health plan because, like we said, more than half of employers do not cover them today. But we know there's a lot of people that take them. So you can see, do they work with like the drug manufacturer and getting the savings cards, or do they know about that and how you do that to do that? But if you go through Noom and enroll in their program, then if you meet their criteria to get into their GLP-1 RX program, they can help give you access to weight loss medications. There's other kinds out there too besides the Wegovy and Zepbound, but they can get you access to the Wegovy and Zepbound too. They would be prescribing it for you though. And you can get it at the direct-to-consumer pricing. So it's significantly lower than that $1,000 that Holly told you that we pay. So I would really recommend that you go ahead and enroll in Zoom, check it out, see if you qualify for the GLP-1 program to see if they can at least give you a decent discount off of the cost of your medications. There's a lot of different options out there, so just make sure explore them to see what you want to do going forward. Now, under the health savings account, generally you can't use HSAs for general well-being, and just to generally try to lose weight isn't considered treatment for a medical condition. But if you can get your doctor to write a letter just for you to have in your file, because I'm sure all of you save all the receipts that you use your HSA money dollars for, because you're supposed to do that in case the IRS ever audits you. You don't have to actually provide documentation to get the reimbursement, but if the IRS audits you, they're going to want to see the receipts that you spent that money on and make sure it was qualified expenses. So if you show all these receipts for weight loss medicines, but you don't have this letter from your doctor saying it was medically necessary, they might say, okay, that's taxable income, now you have to go back and pay taxes on it. So it's good just to get that from your doctor to say you take that for obesity if they consider you in the criteria that's considered obese, or some of these drugs like Zepbound is approved for sleep apnea. So if you have that, they have to actually put the medical diagnosis on there and keep that. You can use your HSA dollars for that too, at least pay for those expenses on a pre-tax basis. You can at least save a lot of taxes from that, so you're not paying that full amount that way. And if you start putting a little bit of money, maybe you're already contributing the max to your HSA, but if you're not, if you start contributing extra now, it kind of gives you a little cushion so that starting January 1st, maybe you have that in there to help pay for those at least with pre-tax dollars. Now, you can use your HSA card at your local pharmacy or even through the mail order right now today. But generally through Noom, your HSA card won't work there because of the merchant code that they submit their services through, so you won't be able to use it for that. So if you can pay out of pocket with Noom and then submit a claim to your HSA and reimburse yourself, you can do that though. Now, because Noom is kind of already has comprehensive services that cover the things that Livongo and Omada were providing, we are actually ending the Livongo and Omada services after the end of this year because of that overlap. You can continue, if you're currently in the Livongo or Omada programs, you can continue to use those devices that you have. So if you have a scale or a blood pressure monitor or a glucose monitor, you can continue to use those. It's just that after December 31st, they're not going to sync to the app anymore. Now, people who are diabetic members enrolled in the Livongo for Diabetes program, you're getting your test strips for free through that program. So we didn't want that to be a takeaway for you. So you can actually order test strips through Livongo through January 31st. But also we made a change on our prescription coverage that you can now get your testing supplies, test strips and lancets, through Express Scripts now at 100% coverage. You don't have to pay anything for those through the medical plan. Okay, so that's really it about those two changes. Now, I don't know how many of you, when you saw the extra medical plan coming out last year, kind of struggled with which one should I take? Or maybe you just went with the one that was the lowest premium, and then when you start having healthcare expenses, you're like, what did I elect? So we tried to put as many examples out there on the website as we could, but we realized it gets very confusing. And then we throw in all these extra terms that it even confused me when I started learning about them. So we put together some slides here. that hopefully will help you a little bit. But first, both of our medical plans are considered consumer-driven health plans, or CDHP. So what does that mean? A CDHP is a type of insurance plan that combines a high deductible plan with a pre-tax payment account, like a health savings account like we have. Back when we had the HMO days, you would go to the doctor, pay $25 copay. That was it. The plan paid the rest. You had no idea what that cost. Now, when you have a higher deductible and you realize you have to pay the first $2,000 or whatever, you're like, wow, I didn't realize an MRI costs so much or X-ray costs so much. So when you have to be more responsible for a bigger portion of the cost, it's going to cause you to take a few moments and really research things a little bit more. And you're going to be more aware of what the total cost of things are, so you're going to ask what the cost of services are before you receive them. That's one of the reasons we implemented Healthcare Blue Book, to help you. If you're going to go for an outpatient treatment or outpatient testing, it makes a difference if you go to a freestanding outpatient testing center versus going into a hospital to have your MRI or whatever. It makes a big difference, but yet your doctor, if they're Mercy or whatever, they just want you to go right to the whatever's closest for them. So take that time to evaluate that. It's also going to cause you to compare prices between providers and services or procedures to determine if there's lower cost alternatives. It'll probably make you want to use in-network providers more, because you're going to pay a lot more if you go to out-of-network providers. And maybe choose generic medications when they're available. And if you will continue to use your preventive care services and get those preventive screenings, you're going to catch things sooner, so that hopefully you can get things treated early and prevent bigger costs later when things become more complicated. So that's the general reasoning behind, or explanation behind, what a consumer-driven health plan is. Some people, I just do this every day, so I think everybody knows what a deductible and co-insurance and out-of-pocket maximum is. And I realize we've had a lot of people just turning 26 and getting off of their parents' plan, so I just want to throw these in quickly. I won't take a lot of time over it, but the deductible is the amount that you have to pay out of your own pocket for healthcare services every calendar year before your insurance kicks in and pays anything. But the thing to keep in mind is that when you have preventive care, so when you have your wellness visits, your preventive screenings, or your kids go to their wellness pediatric checkups and have their immunizations, those are all covered 100% if you go in network. You don't have to meet the deductible for that. It's also waived for medications you take on the Preventive Plus and the Save on SP lists. You're like, well, what are those drugs? Well, if you go to the MaritzBenefits.com website, on the prescriptions page, we have a link to the list of what those medications are. So you don't have to meet your deductible first if you take those medications. Okay, once your deductible's met, then your co-insurance kicks in. Now, your co-insurance is the percentage of covered expenses that you pay after that deductible is satisfied. So generally, like for our plan, if you go in network, our plan pays 80%, you pay 20%. Once your deductible and that co-insurance meets your out-of-pocket maximum, then after that, the plan starts paying 100% after that. Now, the difference between a co-insurance and a copay is a copay is a flat dollar amount instead of percentage. So when you pay a $25 copay somewhere, our plans don't have copays on them, except for on the prescription side. We do have a minimum and a maximum copay for your prescriptions, either after you've met the deductible or for those Preventive Plus drugs where the deductible is waived. Now, like I said, the out-of-pocket maximum, once you hit that for the year, your claims are paid at 100% the rest of the year instead of only 80%. But it does start over again the next year. Then with the new plan last year, we threw in these extra complicated terms, the embedded deductible and true family deductible. And it took me about a month to get them straight in my head, actually, myself last year. So the embedded deductible or embedded out-of-pocket maximum, that's where if you have family coverage, one person, if you have one person that maybe everybody else is healthy and one person has a major hospitalization, or they have a lot of chronic health conditions and they have high claims, the embedded deductible and out-of-pocket maximum kind of protect you, because you don't have to go all the way up and meet that full family deductible or full family out-of-pocket maximum. If they hit the individual limit, that person's claims start being paid at the 80%. Instead of having to go all the way up to the family deductible. Everybody else in the family has to keep accumulating to the family one unless they also meet it on their own. But at least one person is kind of protected and they start having that paid sooner than having to meet the whole family deductible. And I'll tell you on the next slide which of our plans is the embedded and which is the true family. The true family deductible is where it doesn't matter if it's only one person, they have to go all the way up to the family deductible before the plan starts paying for any of their claims. And the same thing for the embedded out-of-pocket maximum. That means if one person hits that individual out-of-pocket maximum, their claims are paid 100% the rest of the year, but the other family members have to keep going to that family deductible or the family out-of-pocket maximum until the rest of it's met. Okay, another thing I gave you is a checklist where you can see what's same or different between the two plans. So both plans use the open access network of doctors, so you don't have to look at that as a difference when you're comparing which plan to take. Same services are covered or excluded on both plans. Again, you don't have to really look at that when you're comparing. Both plans have the deductible waived for preventive care and prescriptions on the Preventive Plus and Save on SP lists. But when you look at the deductibles, that's where the difference is. So the deductible, the $2,300 deductible plan has the true family deductible, not the embedded one. So on that plan, anybody in the family has to go all the way up to the family limit before their claims start being paid by the plan. But the $4,000 deductible plan has the embedded one. So one person does not have to go all the way up to that $8,000 deductible before their claims start being paid. They only have to hit the $4,000 deductible. Both plans have the embedded out-of-pocket max. And that's going to be an interesting, when I show you a different slide, it's going to be kind of interesting when you look at something on that one. But neither plan has the true family out-of-pocket max. So on both plans, if one person hits that individual out-of-pocket max, their claims are covered 100%. Again, that's not something, the dollar amounts of the limits are different, but you don't have to look at that difference when picking what plan. Now, other than that, the premiums are different for both, the deductibles, out-of-pocket max amounts are, and the Maritz HSA contributions are also different between the two plans. Here's one page of here's what the rates are going to be for next year. The first column in each of the plans is the amount you'll see in the deduction section of your paycheck. It's taken pre-tax, so you don't really pay that exact amount. You save a little bit in taxes. If you get the well credit, that will be what comes off in that middle column. It'll be in the earnings portion of your check, though. It'll be a separate thing. But when you net those two together, the amount in the yellow columns is what you're going to be paying per paycheck, so semi-monthly. This is for the full-time pay periods. In premiums. Then when you look underneath that, you're going to see what the deductibles are for each. And it shows that the $2,300 deductible plan has the true family deductible, where the full family one has to be met, but the $4,000 one has where just one person has to meet the individual amount. Shows what the differences are between the out-of-pocket maximums, and it looks like a big difference, but again, when you see these future slides, it doesn't look as different when you compare everything all together. And then you see the final one, the $4,000 deductible plan has less HSA contributions. So by having higher deductibles, out-of-pocket maximums, and lower Maritz HSA contributions, we can offer that plan at a little bit lower premium. Okay, now I'm going to give you some real-life examples. There's going to be a page for each coverage tier. So this one is employee only. The top section, and they're going to be the same on every page, except the premiums will be different. But the top example assumes that the employee only gets their preventive care, preventive screenings, exams. They don't have any other prescriptions they take during the year or any other medical expenses. So the lowest cost option that you would have. If you take and this is how much premiums you would pay in a year, less what you'd get back as your well credit, less what Maritz puts into your HSA account, so you don't have any claims, so you don't have any deductible or coinsurance. Now you see the difference in what you pay overall that combined. You pay about double on the $2,300 plan than you do on the $4,000 plan. But let's say, okay, yes, I normally only go to I only have preventive care, so that's just the plan I'm going to be on. But then that year you actually have, oh my gosh, I have a hospitalization, I suddenly have these chronic health conditions, and I have $20,000 in claims now for the year. Okay, well, let's see how that would play out. So you're gonna have the same premiums, well credit, HSA contributions, but now you have to hit your deductible and you have to hit your coinsurance. So now when you look at it, yes, you're going to pay more altogether under the $4,000 plan, but it's maybe about $1,600 more. So do you want to take that chance and know, okay, well, I really never have anything, so I'm going to go with this one. I'm going to save about $750 a year in premiums, but I know if I do have a bad year, I can afford to pay that extra $1,000 or pay more at the time of service, and in the end, maybe I'm willing to take that chance and maybe pay an extra $1,600. Now, you may not want to do that. Maybe you like paying the higher premium and know if something happens, you're going to not pay that much a time of service because you don't know what your financial situation is going to be at that time. So you really have to just look at all this, and maybe you're in the middle of those. Maybe you do have some chronic or ongoing things, and you need to evaluate where you're going to fall in that bucket and do some real evaluations of things. I'm not going to go line by line on each one, but I have a different page. Here's the employee and spouse one. Again, you save about $2,000 in premiums under the top scenario where it's all preventive care. In the end, you have, on this one I said both spouses, I just doubled it. They both have $20,000, so it's $40,000 total between the two. With your premiums, your well credits, everything all together, you're going to pay $15,000 altogether under the $2,300 plan, and maybe between $2,000 and $3,000 more on the $4,000 deductible plan. So again, do you want to take that chance and save the $2,000 in premiums, knowing if something did happen, you might have to pay that extra couple thousand? Again, you're going to be able to have access to this afterwards, because I know you're not going to remember half of what I'm saying today. I'm getting a headache just saying it. Same example with the employee and child example. Again, it's about $1,500 less in premiums for the $4,000 plan, assuming no claims. But that one's a little bit more. It's more closer to $3,000 and $4,000 if, and this is assuming nobody in the family meets their individual amount. I'm going to give those a little bit. That's what's coming next. So this is if everybody has to combine to the full family deductible because no one person had enough claims on their own. And then there's the family example as well. A couple thousand less for premiums, a couple thousand more if they have to go all the way up to the full $40,000. Okay, now we're going to give some embedded examples. And obviously I'm not giving an example for employee only because they're the only person in the family, so really wasn't an example to give there. But on the employee and spouse coverage, now we're going to say that one spouse had $40,000 of their own claims and the other spouse just had preventive care. So under this scenario, now the $2,300 plan has the true deductible, so they had to go all the way up to that family $4,600 deductible, but they only had to meet the embedded deductible on the $4,000 plan, so they only had to meet a $4,000 deductible. So really, that plan, they're paying $600 less in deductible for themselves. And the interesting thing I was mentioning on the earlier that I said I was going to tell you is the family deductible under the $2,300 plan happens to be the exact amount of the individual out-of-pocket maximum. So once they hit that family deductible, since that plan does have the embedded out-of-pocket maximum, they've already met that, so they don't have any period where their claims only get paid at 80%. Once they meet the family deductible, their claims are covered 100% all year. Now again, this only happens when one person hits that limit. On the $4,000 plan, you're basically, they only meet the individual deductible and the individual out-of-pocket maximum, because they're both embedded there. So altogether on that plan, in the embedded situation, yes, you'd be paying about not even $1,000 more under the $4,000 plan. And if you want to compare from those prior slides I had on the employee and spouse coverage, when everybody had to go to the full family deductible, the amounts at the bottom is what you had to pay. And then here's how much. You can see that the embedded parts to this plan really does help protect you and help you save money if you have one person in the family that really is the one that has something unexpected or has high claims. You can see the difference. And really the difference is going to be on the difference on the $2,300 plan is the $4,600. That's the amount that's always going to be different on these scenarios because you didn't have to pay the 20% co-insurance up to the rest of that out-of-pocket maximum. And on the $4,000 plan, it's always going to be a $7,000 difference because you didn't have to go all the way up to the family deductible and didn't have to go all the way up to the family out-of-pocket maximum. Same example here on the employee and child. The differences are at the bottom. Again, I'm not going to spend too much time on this, but you can this will be out there posted on our benefits website and on the open enrollment page, so you can go look at it. Michelle will talk to you a little bit more later on the timing of that. And then that's the family example. So hopefully that maybe gives you a little bit better understanding of the differences between the two and helps you know how to evaluate it and actually see what happens if you do have something catastrophic. So how do you pick which plan is right for you? So if you have high medical expense families, like if you have multiple family members who are expecting high medical claims, you might want to consider that $2,300 deductible because they have the lower out-of-pocket maximums and higher HSA contributions. If you have uneven medical usage families where maybe one member might be needing frequent care and others might not, then you might want to pick the $4,000 deductible plan, which offers those embedded deductibles and reduced upfront premiums, because I showed you the examples of how that can make a difference. And then if you have families with low medical usage, so they're pretty healthy with minimal expected medical usage, you might want to consider that higher deductible plan so you get the cost savings and lower premiums. But you really have to just consider everything and consider your anticipated healthcare needs, your financial situation, and your risk tolerance when selecting the best healthcare plan for you. Now I'm going to turn it over to Michelle, and she's going to wrap up with a couple of changes to the dental and a couple of reminders, and then we'll open it up for questions.
Thank you, Debbie. I am Michelle Kanaki, the Benefits Supervisor at Maritz. Just have a couple of quick slides, so thanks for hanging in there with us. There are a couple of changes to the dental plans for 2026. Preventive care services from a Premier Network dentist will now be covered at 100% instead of 80%. So right now, if you see a PPO dentist, it would be covered at 100%. So now Premier Dentist and PPO dentist will both be covered at 100% for your annual services for preventive care. We are having a group number change for dental. So new ID cards will be automatically issued for everyone. And remember that only the employee's name is listed on the Delta Dental ID card. So employees' dependents coverage is verified based on the employee's information. As an added benefit, the lifetime orthodontic maximum will be reset for everyone. So if you, as the employee, or your enrolled dependents have already reached your lifetime orthodontic maximum, it will reset as of January 1st. And employee premiums will have an increase of up to $3.79 per pay period, and that depends on the dental plan you select and also the coverage level that you select. For the vision plan, there are no changes to the coverage, and the employee premiums will have an increase of up to 79 cents per pay period, and again, that depends on which coverage level you select. So open enrollment for full-time employees starts November 1st. It goes through November 15th. Open enrollment for part-time is later that month, November 16th through the 30th, and they will receive a separate communication if they're eligible for medical. So this is just focusing on full-time employees for open enrollment. And on November 1st, you will have a workday task in your workday inbox that you'll click on, and you'll go through the screens. And we do ask that everybody make an active election, even if you are declining coverage, and even if you're keeping everything the same. We do ask that you make an election and go ahead and go through the screens and submit. If you're not making any changes, it will be really fast to just go in and hit the signature and submit. So benefit changes outside of open enrollment are only allowed if you have a qualifying life event, such as a marriage or a birth event. So don't miss this once a year opportunity to make changes for any reason, for no reason at all. And if you are adding new dependents to medical, dental, or vision, be sure and send your family documentation to benefits@maritz.com by December 1st. We do require family documentation. And if you believe your spouse is eligible for medical coverage, then please follow the instructions in Workday as you make your elections to determine if additional documentation is required for your situation. And as a note, for the workday process, right now, when you elect medical, it won't let you proceed unless you elect the HSA. That is still true. However, there's an additional step. If you elect medical, even if it's just for yourself, you will have to go through the spouse attestation card. So there's the medical card, and then next to it is a spouse card. You will have to click enroll, even if you're not enrolling a spouse. You will have to click select, even if you're not enrolling a spouse. So it's kind of counterintuitive, but this is Workday. It wasn't customizable, unfortunately. And then you'll finally get to the screen where you can say, I am not enrolling a spouse, or I am enrolling a spouse, but they're not eligible, or my spouse is unemployed, those choices like that. So you have to go through a couple screens to get to that attestation. So if you have any questions, just reach out. It'll be easy to understand once you see it, but getting to that point might be challenging for the first time, and that's totally understandable. So I want to invite you to the virtual benefits fair that we have again this year, coming up later this month. You should have received a save the date on September 29th from benefits@maritz.com. So we hope everybody can join us then. And this meeting is being recorded. It will be posted on the open enrollment page of our Maritz Benefits website sometime later next week. So that's what Greg had said. And we will open it up for questions. And we have 2 microphones here in the theater. If you want to ask an in-person question, please just don't share any personal health information. If you want to submit a question on Menti, you can do that. Nobody will see that question. Nobody will see who submitted that question. So if you need to add a little more detail, that's fine. Or you can always reach out to someone in the benefits department. Benefits@maritz.com is the best place to submit a question, or you certainly can reach out to me directly or Debbie directly if you feel more comfortable doing that. And now Jen Kuhl is going to come up and help answer any questions, and Debbie as well.
This is on. Am I on? Hi. Thank you. Okay, so we're going to open it up for questions. For those who are live here in the audience, we have a couple of microphones. We can have someone come to you. If you're more comfortable asking it online, please do that with the code, and we will go ahead and get started. Don't be shy. All right, first question. Thank you for being brave.
So if somebody already has a current subscription to Noom, how can you connect that to the Maritz subscription?
I can take that one. I know the answer to that one. Yay. Great question. So we did talk to Noom about that. There is a way that they will help you transition your current membership into the Maritz paid membership, and then you won't lose any of your data or any of the lessons and things that you've already done. So there will be some transition steps that are sent out, and then it seems like it'll be pretty seamless for you.
But I think you'll probably have to wait till January 1st to do it because it won't be active. Nobody can sign up or anything till we actually are effective with them, which will be January 1st. We will send out more information about Noom as more details become available. There'll be a lot more information about that program.
So I have a separate question, and this is really personal. As my vacation, which I hardly ever take vacation, I planned a vacation. It's November 1st through November 15th. So
you can access Workday anywhere.
I'm going to try to disconnect from work. So who do I talk to afterwards about my personal situation?
Yeah, we have a couple of people. We have people with travel that sometimes have to be gone and don't have access. So if you talk to Michelle, she can work out right now all the 2026 benefit information is out on our benefits.com website. So if you go out there and look at everything, you know what elections you want to make. Maybe you say, I don't want to change anything. Let us know, and we'll make sure that you get those submitted.
We do need it in writing. So if you want to
Yes.
send me an email or benefits@maritz.com, if you're not able to access Workday during that time frame, then we can push that through for you, and we'll just attach your email to your elections.
We have a question over here.
Yeah, so I have a question about the HSA contribution. currently the way that it's being put on the W-2, all the tax preparation software is using that as an excuse to charge very large amounts of money. So last year it was over $100. So if you have a $500 HSA contribution, 25% of it's just going to tax preparation. I was wondering if there was any way that you can change the way that gets put on the W-2. I can't be the only person that's ever noticed this, right? So,
I have not heard this before, so
Oh.
if you wouldn't mind reaching out to the benefits at Maritz
Okay.
box, and then we'll coordinate with payroll to get a little more information from you. And
okay, so everybody's just paying this? And,
I do my own taxes, so I don't know.
no, well, this is online. I mean, so like if you want to do it digitally, right? If you do a paperwork, then you wouldn't notice it. But the state of Missouri, in order to file digitally, you have to use one of the federal preparation softwares because the state of Missouri doesn't have their own. So,
yeah, it's the first we've heard of it, but we'd be glad to look
Okay.
into it and see if there's
Okay, thanks.
anything we can do to assist.
Because I think we're required to put certain types of deductions in exact boxes. I don't know that we have the ability to change it, but
We'll check
look
into it.
Yeah.
Yes. Karen, do we have any questions up in the booth yet?
Yes, we do. Question, if both spouses are employed at Maritz, do they need separate plans?
No, they can be combined. We're paying for it, you're paying for it either way, so, yeah.
That is one of the options. So when you see the spouse card, after it's medical, then spouse, you click enroll, then you click select, and then the drop-down will show my spouse works at Maritz. That's one of the choices to choose once you finally get to that screen.
Yeah, then they can stay on. You can do it combined or separate, however, whatever works best for you.
Good question. We do have more spouses at Maritz than you would think.
Yes, that's true.
Okay,
Any
and
other
another
questions in the booth,
question,
Karen?
Oh,
someone asked about GLP-1 being used to treat sleep apnea. Is that covered?
Currently, today, it is not covered. The only GLP-1 drugs that will be processed through the plan that are approved today are for diagnosis of diabetes.
Do you want to take that one over?
Yes, question. This is personal in a way, but I don't mind sharing. So I am considered overweight based on my body type and according to the charts. So I believe there's a $100 credit for being underweight or being at your ideal weight. Without covering the weight loss medicines, have you considered relaxing the standards for the wellness credit for weight loss or for weight?
That is no
Yeah.
longer
Those-
applicable.
yeah,
You just have
so-
to do your screening,
Yeah,
and you
those
get the well credit no matter what.
requirements- yeah, those
no matter what your
requirements
results
were
are.
removed over a year ago, perhaps two. So anyone who completes the biometric screening simply by doing it receives the full well credit. That was definitely in place last year.
Regardless of your results.
So those requirements are not applicable, and they have not been.
Yeah, because we knew some people maybe were not doing the screening because they're like, well, I'm not going to make it anyway. I'm not going to hit these targets for the different things. But we just want you to do it so you get a good report of your wellness overall. So now just do the screening and you get the well credit. Easy $600 on your paycheck.
Yeah. All right. Any more questions in the booth?
Yes. Question, can anyone join NUM or do you need to have qualifying conditions?
It can be anybody. It doesn't matter what your condition is, but you just have to be enrolled on the medical plan. And it's you, your spouse, and dependents over 18 or over.
Okay, and another question. I know enrollment has to happen during the open enrollment period or within a life event, but can you decline at any time?
No, it has to all be done during open enrollment,
So once you've
or you have a
elected,
qualifying event.
once you've elected your open enrollment elections, you're locked in until next year's open enrollment, unless you have a qualifying life event. And submit your request within 31 days and provide supporting documentation of the event. So if you enroll, you're locked in. If you waive, you're locked in.
Now, if you waive November 1st, you can change your mind as many times as you want till November 15th, and you can change it.
You have
But once
15
October
days.
15th comes and we close it down,
15
then you have
days
to have a
to change
qualifying
your
event.
mind.
You get 2 weeks.
Yes.
Any questions in the audience? I want to make sure I'm not missing a hand up. Okay, Karen, if you have more questions in the booth, we can keep going with those until we get anything else in the audience.
Okay. Question, to confirm if a spouse retires mid-year, can they join our plan? And where do I go for info on what is needed, how long it takes, coverage costs, et cetera?
So yes, if they lose coverage mid-year and they have no access to employer coverage, maybe it's next June and they retire and they have no employer coverage, that would be a qualifying life event, and that you would have 31 days to submit that request in Workday. All of the rate information is on our benefits website, maritzbenefits.com. We do require supporting documentation that confirms there was a qualifying life event, so from the employer, former employer, that states when the employment ended. And there will be just the normal process of selecting the spouse card, confirming your spouse does not work. That'll all be part of the Workday process to submit the request.
And we do have job aids out there. If you go to the what's our website? MaritzBenefits.com. Go to Overview and Getting Started. Top section says, how do I change my benefits due to a qualified life event? And you click on that, there's a Workday job aid that'll tell you step by step how to do it in Workday, what documentation is required, who you send it to, what your deadline is. So it'll really give you everything right there. But you can always reach out to the benefits department if you have questions at that time.
Okay, we got time for another question. When does the $600 credit get issued? What paycheck? Is it bundled or separate?
Every paycheck throughout the year. So it's $25 per paycheck. So if you total that through the 24 paychecks, then it's $600 for the year. It's in the earnings section of the paycheck. It is not mixed in with the pre-tax deduction section for the medical premium.
And if you cover your spouse on the plan and they do a screening too, then you get another $600 for them, or an extra $25 per pay period, so it's $50 per.
So just make sure to get that screening done. The deadline is December 31st, but if you wait till the 31st, Personify Health probably isn't going to have the results back by then, so it's better to do it no later than December 15th. I always just tell everybody December 15th gives a little administrative window, because the deadline for them to have the record of it is December 31st, and we don't have the results. They just tell us who completed it in time.
And just to add to that, was it just last year? We did change. There's not this small window of time to get your biometric screening done anymore. It is open at the beginning of the year.
All year.
So if you want to get it done in January for next year, you can start immediately. So if you haven't made an appointment yet with your doctor for your annual visit, please get that set up. Sometimes it can take a while to get in if that's how you normally get your screening requirements done. And there's no special window. So you can do it right now and get it off the list before the holidays hit, so you're not stressed trying to do it in November and December. And then for next year, you can start doing it as soon as the year flips over.
And you can either do it through your provider's office. You can go to Personify Health and download the form that you take to them so they know what tests have to be done, and they fill in the results and submit it to Personify Health. Or you can go to a Quest lab, but you have to go through the Personify Health website to say you're doing it through a Quest lab and print the form that you'll take to them too.
Last time I did that, it was down. I don't know if that happened anybody else. Like, I went to Personify and I went and tried cutting over the Quest. It was just, I was getting bored or something. So is that just a one-off thing?
Probably. If you ever run into that, though, be sure to reach out, because we don't want anybody to miss out on their opportunity. We reach out to Personify, and they reach out to Quest if there's problems like that to try to get resolved. And we do, even if we have to do something manually, we'll figure something out so you get it in.
And a couple things about the wellness program. So if you do go the provider route, so you get the form from Personify and you go to your provider, if you see them or talk to them about anything other than your wellness visit, if they want to do any other labs aside from what is required for the wellness visit, for the biometric screening requirement, then they will bill that as diagnostic. They won't piece it out and say this piece was preventive and this piece was diagnostic. They will say the whole visit is diagnostic, and you'll have to pay your normal deductible and coinsurance wherever you're at in the year with that.
For the screening.
For the screening. And the Quest option, when I did it, and I went through Personify, I chose the Quest option, and I got to Quest. I had printed the form, but they didn't need it. They already had it in the system. So there's that connection between Personify and Quest, so that was really convenient as well. And that was totally free.
Quick question. How much of the plan is being funded by Maritz? Is it 50%?
It varies by tier, so I don't have those numbers in my head. But again, when we look at the portion that we pay as a company compared to other employers, we do ensure that we're meeting that competitive benchmark level, that we're funding the plan as much as a comparable employer would do.
I think it's over 50% though, isn't it?
Oh, yeah.
But it's over 50%. And the thing, like Holly was saying about the risk, we set our premiums for the year thinking, well, here's what we think our claims are gonna be, but if the claims go way higher than that, Maritz has to put in whatever extra above it for that year we just have to pay that out of our bank account. And then that's when that all gets taken into account when we set our premiums for the next year. It has to be covered between what you pay and what we pay.
Karen, anything more in the booth?
Yes, question. If I already had a screening at my annual physical, do I need to do another test with the form, or can that form be filled out months later?
I think you can just give the form to your doctor
Yeah,
and see
just
if they'll
take
fill
that
out
form.
with what those results were, as long as it was in 2025.
Get the form from Personify Health, from your Personify Health portal. You have to be logged in, and then send that form to your provider. They should be able to fill it out since you were already there.
Any other questions?
No.
Last call.
You're done up there too, Karen?
We're good here.
Okay. All right.
Okay, thank
you
you
for
all so
coming.
much.
Thank you.
Oh, do you have a question? Oh. Oh. Yeah. You want to take mine?
Sorry.
Actually, can you wait? Because we do have people online
people,
for the
yeah.
recording, so we want to
We
make
record
sure they
it.
hear the questions too. But inquiring minds might want to know. Oh,
Oh,
Okay.
personal,
Yeah.
yeah.
please-
Or you can come up
please
to
feel
us.
free
You
to
can come
reach
down to
out.
us before you leave.
yeah.
Okay,
Okay.
all right, last call for real. Okay, thank you all so
Thank you.
much.
Yeah.
Take care.